The Auditor-General of Kenya, Nancy Gathungu, has unveiled what is one of the largest public finance irregularities in the recent history of Social Health Authority, identifying anomalies that left more than 50,000 billion shillings in question transaction within the management of the medical claims under the country's new established universal health insurance system. The report tabled in Parliament and covering the 2024-2025 financial year detailed systemic weakness in control and oversight that enabled a vast portion of public funds meant for healthcare to be diverted or paid out without a proper justification. Among the most alarming findings in the Auditor's General report are records showing a patient who allegedly underwent open heart surgery 4 times within a single day, and another whose medical record indicate 10 childbirth delivery within a single year, all of which were approved and paid for by the Social Health Insurance Fund, SHA. Auditors describe these not as a simple data error, but an indicator of a deeply compromised claim system. A medical professional noted that open heart surgery requires stopping at the heart and placing the patient on a bypass machine, making multiple procedures within a day physically impossible. Beyond the upside individual case, the auditor intensified shillings 7.32 billion paid to cover 1,000 facilities for service not authorized under the SHA benefit package and 1.7 billion shillings paid to facilities that were not even contracted by the authorities. A further shillings 4.78 billion were dispersed using service code that have not been gazetted, making those payments legally questionable. The audit also flagged thousands of instances of repeat and approved surgical procedures, with the total payout running into hundreds of millions of shillings. The irregularities in the Auditor's General report goes beyond technical accounting errors and reflect broader structural weakness in the implementation of the social health authorities itself. Prior to this revelation, Principal Secretary in the Ministry of Health had acknowledged that the program was beset by widespread fraud, with estimates suggesting that between 28 and 38% of medical claims processed through the system were fraudulent. Hospitals, some reportedly tied to the influential individual, received millions to shillings for questionable service, leading to public outcry and government investigation. A separate Ministry of Health audit covering the period between October 2024 and April 2025 found that Kenya lost 11 billion shillings through fraudulent claims submitted to the SHA, with the bulk of these claims originating from private hospitals operating under the Universal Health Coverage Scheme. The audit revealed that some facilities firstly converted outpatient service into inpatient admission to claim a higher payout, while those billed for services never rented inflated the charges on the same procedures or repeated unusual high numbers of cesarean section far above World Health Organization threshold. The Health Cabinet Secretary Aden Duale moved swiftly to challenge the narrative around the 50 billion figure. Duale dismissed a claim that shillings 50 billion had been lost, saying figures cited in the media reported was misinterpreted and stemmed from the misunderstanding of the statutory accounting provision and transitional financial process. He attributed shillings 26.8 billion of the question amount to an outstanding claim reserved, funds set aside to settle hospital bills for treatment already provided, but those whose framework had not been submitted by the close of the audit period, arguing that failing to set aside such reserve would itself be unlawful under the International Financial Reports Standard. Duale insisted that no billion had been lost or misappropriated, and urged that the described as responsible reporting on complex ensuring accountability processes. The Auditor General report did not only detail financial discrepancies but also highlighted procedural breach linked to the procurement and contract management within the SHA. In March 2025, Gathungu revealed irregularities in the procurement of the technology used to manage the SHA system, highlighting unbudgeted and non-competitive procurement as an underlying scope of work and lack of a proper payment agreement as legal violation committed during the procedural processes. The ownership of the system was also questioned as it emerged that it was being managed by a private consortium. The scandal has drawn a scrutiny to the digital infrastructure underpinning the system. The audit found that the Social Health Authority does not have full control over the digital infrastructure used to process claims, raising concerns about oversight and accountability. The report further revealed that SHA funds are held in an escrow account controlled by a private agent with no disclosure on the identity of signatories or oversight mechanism. The state response has moved beyond a public statement to active prosecution. 8 health facilities and several individuals are now facing prosecution after the director of public prosecution ordered charges of alleged fraud targeting the SHA, following a review of investigation files submitted by the Directorate of Criminal Investigation between late January and late February 2026. Among those charged are directors of the Danaba Care Hospital who face charges of conspiracy to defraud and operating an unlicensed health facility. The regulatory official from the Kenya Medical Practitioners and Dentists Council have also been charged, accused of facilitating the illegal licensing of medical facilities that later received payment from the health fund. The most recent prosecution to emerge from a scandal involved a suspect linked to a facility in Nairobi pipeline area. Michelle Otieno Okumu was charged with several counts, including obtaining registration by false precedents, making false statements, falsification of document, and accusation of a proceed of crime after investigators connected him to an irregular practice at Salama Yard Medical Center Laboratory and Maternity Services.